name is Rick Fernandez. I'm the Assistant Superintendent of Secondary Schools for Tomball ISD. We're a medium-sized district for Texas. We have about 18,000 students and about 2,400 staff members. So some of the challenges we faced preparing for reopening during a pandemic, number one, the information. And how do we get the most accurate information as quickly as possible? The other thing is, once we have that information, what do we do with it to provide solutions and make sure we're safe? And so as we have filtered through the information and we are looking at, okay, are we equipped to be able to do this, especially if things spread quickly or there's an outbreak? And then how do we go through our problem-solving process with our current team, and are there ways to expand our knowledge base, our support, and particularly with Axiom, looking outside and thinking outside of the box to find other ways to get all of that information, ideas, solutions quickly. So honestly, I didn't know anything about Axiom, and it was by a chance meeting with another business partner in our community that I was introduced. And quickly, I began to understand that their why and our why are very aligned. It's about helping people, about serving a community, and it's very much mission-driven. And so once I got a feel for that, and then I learned more about the type of work that they do, the support that they can provide, we initiated some conversations, and we brought that information back to our team. And so Mark Robinson and Darrell Wheeler were the two points for contact with us, and really helped us think through the process, learn about what it is Axiom can do and provide. And so it was different because we've not done that in education before, but our teachers were on board, our principals were on board, and it was something that we definitely felt was going to add value to our district. So the first thing I liked was I could use it easily because I'm not the best at apps and thumbing through everything. That's not me, that's my kids. The other thing is the responsiveness. So on the time that I screwed up the app and didn't read the question correctly, it alerted, and immediately I had a call back and checking on me to make sure I was okay, that I was healthy, that I was okay to go to work, and did I need anything in regards to my health. And so that let me know that if someone's calling immediately, my staff, my employees, and our community are going to be well taken care of. And that was key because I was unsure of, okay, when will they have the time to actually call if an employee is not feeling well? It was instantaneous, so I was very, very happy with that. Currently, we are using the Check-In2Work app for all of our staff members in Tomball ISD. And it has been great. Quick responses if someone's not feeling well. Our administrators and our central office staff have immediate access to that data, so we can plan if there needs to be a substitute or we need to enhance cleaning policies or procedures. So all of those decisions that you need to make very quickly, we have the ability to do that at a little bit faster rate than if we didn't have access to that information. So that has been very vital to our reintroducing staff and students to the buildings. So at first, they were unsure because, again, this is something that's brand new to education. And so kind of outside of our box. But as soon as they were able to see, hey, this is how it's going to help and support, and these are the resources that you're going to have, and not only will you be taken care of, but your colleagues will be taken care of, and everybody collectively will be able to ensure the district health. They immediately jumped on board. They were very excited about that prospect. Our school nurses love it because a lot of the burden falls to our health experts on the campus level, and it just helps them so much with the flow of information and what to do with that information once we have it. So we've received a great response from staff and all of our administrators, all of our faculty. So implementation was great, and our Chief of Human Talent, Jeff McKenna, oversaw the bulk of that work, and Axiom has been there every step of the way, from our data integration, how the systems would talk to each other, and how we best get access to the data, who needs what access and how it needs to be filtered, and then the rollout and the training process as well. So they've really been there every step of the way and given us some feedback and some guidelines of how other people have used it, and then also tailored it to the way we felt it would be best for our district to utilize. We're not the experts, right? We're the experts in education. So when we realized we've got to make some decisions that is not in our field, we've got to find the group or the people or the resources that can help us make those decisions. And so our school nurses are our health experts on campus, but obviously they're handling students and the day-to-day medical needs of students and parents. So with Axiom, it gave us the opportunity to expand our services to our staff and expand our wellness services to make sure that we're keeping everyone safe as we begin kids coming back to school, staff coming back to school, and it's really been a great asset to our district to be able to do that. So the advice I would give other schools and other industries as well is get outside the box, and there are great options out there. Axiom is an option for us that we feel like has added a ton of value. And if you're having issues and you're just strained and the work of your staff is being redirected to mitigating all the things that come with COVID-19, absolutely, I would recommend Axiom to other school districts, businesses, for several reasons. Number one, and first and foremost, is their why. Educators are service-driven, and this is our mission. And we love to partner with businesses and companies that their why is very similar to ours. And so their experience and our experience has been a partnership. It's not been a transactional vendor relationship. And that's been extremely important to us because this is a situation that none of us have ever dealt with. And to know that they're there to help us and that their why is driven about service to the community, it puts us at ease, and it makes us feel that we have a partner that is genuinely interested in our staff, our students, and our community. And you just don't get that all the time in education. The second reason is the ease of use of their apps, their data, their response time when something does come up. The first thing I did when I got the app is I let my kids try it out because they may be the ones using it, right? So I let them go through and see how easy it was for them to check into school. I tried the CHECKIN2Work just to get a feel of what it would be like if kids woke up in the morning and said, all right, I gotta do this. So my kids had no problem with it. That made me feel great. And even when I did have problems with it because I misread the question, there was an immediate response. So within 2 minutes, I got a phone call from an Axiom nurse checking on me, making sure I was okay, asking me, about the question that I missed. And luckily she was very understanding, and I said, no, I just messed that question up. So, but it just made me feel better that within 2 minutes, somebody was already checking on me, which means somebody's checking on our staff as quickly. So gives us a great peace of mind.